Why do blood thinners increase hemorrhagic stroke risk? Have you ever wondered why blood thinners, while essential for preventing certain types of strokes, can also increase the risk of another kind? Blood thinners, also known as anticoagulants, play a crucial role in managing the risk of ischemic strokes, which happen when blood clots block blood flow to the brain. However, they can also raise the risk of hemorrhagic strokes, which occur when a blood vessel in the brain ruptures and causes bleeding. The reason behind this increased risk lies in how blood thinners work. These medications reduce the blood's ability to clot, which is vital for stopping bleeding when blood vessels are injured. While this property is beneficial in preventing clots that can lead to ischemic strokes, it also means that if a blood vessel in the brain is damaged or weakened, the body may struggle to form a clot to stop the bleeding. This can lead to a hemorrhagic stroke, where bleeding into the brain tissue can occur. Certain blood thinners, like warfarin, rivaroxaban, dabigatran, and apixaban, are effective in preventing strokes caused by clots, particularly in conditions like atrial fibrillation. However, they can also make any bleeding that does occur more severe. For instance, if a blood vessel ruptures, the suppressed clotting response can lead to life-threatening situations, making hemorrhagic strokes one of the deadliest types of strokes. The risk of experiencing a hemorrhagic stroke while on blood thinners can be influenced by several factors. One key factor is the intensity of anticoagulation. For example, patients taking warfarin must have their blood clotting tendency monitored through a test called the International Normalized Ratio. If this ratio goes above the recommended therapeutic range, the risk of hemorrhagic stroke significantly increases. This highlights the importance of careful monitoring and dosage adjustments to balance the benefits of stroke prevention with the risks of bleeding. Other factors, such as age, high blood pressure, and the presence of fragile blood vessels, can further elevate the risk of hemorrhagic strokes in patients taking blood thinners. Additionally, interactions with other medications or supplements can alter the effectiveness of blood thinners, potentially increasing the risk of bleeding. Despite these risks, blood thinners remain as a cornerstone of stroke prevention for many individuals. They significantly reduce the likelihood of ischemic strokes, which can be devastating. Advances in medical care, including the development of reversal agents that can quickly counteract the effects of certain blood thinners in case of bleeding, have improved management and outcomes for patients who may experience hemorrhagic strokes while on these medications. In summary, blood thinners increase the risk of hemorrhagic stroke because they impair the blood's ability to clot, making it harder to control bleeding if a blood vessel in the brain ruptures. This risk must be carefully weighed against their proven benefits in preventing clot-related strokes. Personalized medical management and regular monitoring are essential to optimize safety and effectiveness for individuals on these medications. Always consult with a healthcare professional for tailored advice and management strategies.